Hello and good evening. We have the incredible pleasure of speaking today with Dr. Marian Laderoute, all the way from Ottawa in Canada. And we are talking about some incredible stuff to do with immunology, immunosenescence, in aging, COVID-19. I think this is going to be truly quite fascinating. Marian, how are you?
I'm great. How about you, Philip?
I am fine. The weather here is looking great today. How is it on your side?
Very sunny.
Yeah, it's sunny all across the world. So that's wonderful. So I would like you to introduce yourself to the audience. And remember, I want you to say about some of the tremendous work that you've done in the past. So go ahead, Marian. Tell us a little bit about yourself.
Well, I'm an immunologist and a medical scientist. And I guess my claim to fame is I wrote the immunosenescence paradigm and published it in Discovery Medicine in 2015. And I also, when I was working at the Public Health Agency of Canada in the blood zoonotics unit, I discovered that humans have an angel virus, this so-called HERV-K102, which is located on chromosome 1. It's actually a retrovirus, but it's a foamy retrovirus, and it's protective against viruses.
Wow, that's quite incredible. So yes, we do have a genuine celebrity with us today. So wonderful. Really glad to hear that. And before we go into that, the detail of that work, I just wanted to take a moment and mention something with regards to dementia, because dementia does remain my passion. And even in the midst of COVID-19, you have been doing quite a bit of work as well on this prior to all of the COVID-19 stuff.
Oh, you want me to talk about dementia, or do you want me to talk about COVID-19? I'm sorry.
No, we're just doing a mention. I'm just mentioning the fact that you've done quite a bit of research as well in relation to that. Yes, we're not going to talk about it in any detail. I'm just making my listeners aware that it is something that is in our future agenda, but COVID-19 has certainly taken the attention of most of the researchers, including yourself. Yes.
Yes. I have been working on a product called New Sleep, which is a mixture of nutraceuticals, which I hope actually it's designed to counteract the effects of stress on sleep, and then the effects of poor sleep on the immune system. So it's a new product, and hopefully it'll be launching, who knows when, but soon. But it's designed to help people with to prevent Alzheimer's disease, actually.
Wow. And that's something that we'll probably focus on at a later date in some detail. But today, our primary focus is on COVID-19 and the immune system. Okay, so in terms of what's happening in the world, you've really gone into using the background of the immunology to look at this disease. And you've made reference to immunosenescence, especially in the context of COVID-19. Most people have no idea what that means. How do you explain that?
Well, immunosenescence, I defined it as the failed release of these protective HERV-K102 particles from foamy macrophages. And so if you can't release these protective viral particles, then you're going to be suffering when you're encountering a brand new virus, such as in a pandemic condition.
So let me just clarify for people who probably don't quite understand anything about immunology. When you say the foamy macrophages, these are specific, quite large white blood cells that are very important to our immune function. And in effect, the specific retrovirus DNA is actually encoded, as you said, on chromosome 1. And so it's fixed in position and has a protective role.
Yes.
Yeah. So in that sense, are you saying in terms of immunosenescence, is that where this function is not as active as it should be?
Yes, what I'm saying is it's blocked. Now, the condition that controls immunosenescence is a very poor DHEA to cortisol ratio. Now, as you age, you lose your levels of DHEA. It drops off quite dramatically. If you see the top left-hand corner, you'll see in males, it's by the time a male turns 50, he has significantly less DHEA in his system compared to the females. And so the males, by the time they're 50, they're at higher risk of viral infections, particularly brand new pandemic RNA viruses. So if you actually look at that image, you'll see that it mimics exactly what we see for COVID severity and susceptibility. In other words, males are at higher risk of contracting COVID-19 and they do poorer. So it actually matches the DHEA profile with age.
And so when we see the DHEA, what specifically are we talking about? Is this a hormone that is in men, in women, across the board?
DHEA is called the youth hormone. And what it essentially does is it counterbalances the bad effects, if you will, of cortisol, stress, the stress hormone. Both are released by the adrenals. So as you age, you have less DHEA and proportionately more cortisol. So this stress actually puts you at higher risk of immunosenescence. And the higher immunosenescence you have, the worse you're going to do when you're fighting a brand new virus.
And in the context of the immunosenescence, one of the things that I've noticed is that they've mentioned things like thymic atrophy. So the thymus gets smaller. And so is it that you have less immune cells?
No. Well, the thymic atrophy that you refer to basically impacts the adaptive immune system. Whereas here, when we're talking about immunosenescence, we're talking about monocyte macrophages, which is your innate immune system. And the innate immune system, interestingly, is the actual frontline workers of the immune system. So you really need to have this engaged to fight COVID-19.
Wow. And so in effect, when we looked at that chart, we could see that tailing off of the hormone. And in your mind, is this why you think that we're seeing this spike, certainly with men who are over 50, significantly more than women?
Yes, I do believe it's due to the poor DHEA cortisol, particularly that occurs earlier in men. As you know, men basically have a 5-year, their lifespan is about 5 years shorter than women. And to me, it's all based on this difference in the DHEA cortisol ratio.
Wow, wow. And that's quite remarkable. And so in the context then of therefore this immunosenescence with the reduced DHEA, the thymic atrophy, the reduced, I guess, macrophages and monocytes,
they're not reduced. They're not reduced.
Mm-hmm.
They're not reduced. The macro. I'm sorry.
Sorry, I mean, is it that they're just not as active?
They're dysfunctional. The interesting thing about immunosenescence is that these macrophages are dysfunctional. They're immunosuppressed, and paradoxically, at the same time, they're releasing these pro-inflammatory factors, TNF-alpha, IL-1 beta, IL-6, and others. So the most people view chronic illness as an inflammatory disease, but it's not. It's a immunosenescence disease. In other words, the macrophages are immunosuppressed and releasing these pro-inflammatory factors in an unregulated way. So to treat a chronic illness, And to prevent viral infections, you don't use an anti-inflammatory because that contributes to immunosenescence. You have to go after what's causing the actual mediator of immunosenescence, which turns out to be, according to my theory, alpha-fetoprotein, AFP.
Wow.
AFP was the very first immunosuppressive factor described, 1975. The first tumor marker discovered, 1963. And in 1991, I discovered that it actually binds to the 67-KD AFP receptor on macrophages and prevents the lysis or the apoptosis. So this is why the immunosenescence refers to the failed release of the HERV-K102 particles. It's because AFP is blocking the lytic release. So if you can antagonize the AFP molecule, then you can reverse immunosenescence. And we did it in our clinic at ISM, Immune System Management Clinic and Lab in Ottawa, for over 20 years, if you can believe that.
Wow. And so when you look at these particles, because we've got this image that you've got here, could you explain a little bit more about these foamy particles?
Okay, well, it's the macrophages, when they produce these particles, they accumulate in these vacuoles, and you can see it kind of looks lacy by
and which
EM.
one would this be? Would this be the image to the top right, bottom?
Yeah, so the images in black and white on the right are the EM pictures, transmission EM, electron microscopy.
Yes.
So and on the left is the H&E stain of the foamy macrophages as they're building up the amount of particles inside. So they become big and fluffy, and pathologists call them lacy foamy macrophages. And
so
inside,
this one here, is that a single cell?
Yes.
And this is the nucleus here, and all of the foamy particles, what are they filled with?
Okay, so those are the vacuoles that you're looking at, those bubbles that look like foam. And inside each of these bubbles are hundreds, if not thousands, of these 100 nanometer particles that look like foamy retroviruses.
And so these counteract the effect of the RNA viruses.
The particles are believed to undergo the particle. The neat thing about foamy viruses is they can enter any kind of cell. So if they enter a normal cell, they just integrate into the DNA, and so now you have more copies. So the normal cell now is armed. It's got more copies of the protector virus. But if the cell is transformed, such as it's a tumor or it's transformed by a virus, then when the HERV-K particles enter, it undergoes what's called a lytic infection. And surprisingly, people were amazed to see that this happens in 24 hours. So 24 hours after the particles enter, it completely lyses the cells if they're transformed, such as by viruses. So the particles themselves are actually oncolytic, they kill tumors, and virolytic, meaning that they kill cells that are infected by a virus. But that's not all about the system. That's just the particles. What's really interesting is that it acts like a vaccine. So the particles, they're in the blood, and they will enter any kind of cell. But when they bind to innate T and B cells, which have receptors on their surface for the envelope protein is studs on the outside of the particles. So these T and B cells, they will bind the particles, and it will activate those innate T and B cells. Now you have innate, not adaptive, but innate T cells that can recognize the envelope that becomes expressed on virus-infected cells, but not expressed ever on cells that are normal. So these T cells or antibodies to HERV-K102 envelope, they will do their job by recognizing the envelope of HERV-K102 particles, which is actually expressed on the surface of abnormal cells that are either tumors or virus-infected cells. So it's a dual system, and what's really neat about it is that it's a vaccine. It's an innate immunity vaccine that goes on inside your body when you're fighting COVID-19.
Wow. So let me try and break that down. It's quite complex to understand. So the T cells and the B cells, for people who may not be aware, these are lymphocytes, another part of our white cell community that usually are quite specific at targeting, at least the T cells, say virally infected cells. So you're saying that these HERV-K102 particles activate these T cells and almost make them even more focused on virally infected cells.
Well, their activity is not, if you look at a normal person with no infection, no tumors, you won't be able to detect these innate T and B cells. But once you have a virus infection, they get activated. So for example, these have been described quite well in HIV patients, and it's been best studied in breast cancer patients. So they can show that part of the response to the tumor or to the RNA virus is actually through this recognition of the envelope protein that becomes expressed on these abnormal cells. So it's quite exciting to see that you have particles, and then you also, the particles behave like an autologous vaccine, an innate vaccine, which also helps you to fight. So you have the best of all worlds. You have the particles, which will kill the virus infected cells, and now you also have T and B cells. And what's striking about the expression of the envelope, at least on the surface of breast cancer cells, is you don't need complement, you don't need ADCC activity, you don't need an active FC receptor. Just touching with this particular antibody activates the apoptosis machinery. So now the cell dies. So it's wonderful what Mother Nature has come up with.
So in effect, this is like a perfect system built into our body. So looking at this diagram here, could you take us through what this means?
Okay, so as I was saying, the condition which is necessary but not sufficient for immunosenescence is that you have low DHEA and relatively high cortisol. Now, DHEA, actually, I showed in that article, in the 2015 Discovery Medicine article, I showed that DHEA, but not DHEAS, the sulfated version, which is not active in vitro, I showed DHEA can actually bind to AFP and inactivate it, so that now AFP can no longer block the lysis of normals, like of cells. So for example, the actual methodology was using thymocytes, but innate thymocytes. Anyway, so when you don't have enough DHEA, that means the active there's not enough to inactivate AFP, so now there's too much active AFP in the system. So when there is a virus that comes along and induces these the HERV-K102 particle production in these foamy macrophages, if you don't have enough DHEA, you're not going to get lysis and release of the particles for protection. But if on on the other hand, if you, so in the clinic, for example, at immune system management, we were using flavonoids to reverse this so that people who came in with a severe illness, such as advanced cancers, we were able to reverse the immunosenescence, and they were able to recover, sometimes quite remarkably within a month, but most people take 3 to 6 months. So it's a condition where it's reversible, and once you have the release of the particles, then you have the system is activated, and you're basically protected, I guess. But
and so in that context, then it needs to be something that is built up over time. So it's not something that can just suddenly work today for somebody who is unwell today, is it?
Well, between the in vitro, between the activation and the release of the particles, it's 6, depends on how you count it, 6 days or 7 days, 6 to 7 days. So at the end of 7 days, there's enough buildup of the particles inside of the foamy macrophages, so now it can be released.
Right, right. And so for, in a sense, as we're trying to look towards finding a vaccine for COVID-19, which could take a long time, and we have whole economies shut down, are you suggesting that if we can build up the levels of these almost the foamy macrophages, people would be protected and you'd have far less mortality? Is that about right?
Okay, in COVID-19, if you look at all the risk factors and all the, the comorbidities, the diabetes, the hypertension, the cardiovascular disease, people with tumors, it's all about immunosenescence. So if you want to make more people in a protected state, you would just want to make sure they don't have immunosenescence. So a good marker of immunosenescence is hypertension. So if your blood pressure is over 140 over 90 millimeters of mercury, then you are at increased risk. If you don't have hypertension and you don't take any drugs and you don't take herbal medicines and you don't drink alcohol, you don't smoke and all these other things, then you're not going, in theory anyway, you're not going to be bothered much by the COVID-19. But in frontline workers, they put their lives at risk, and for those people, it would be useful to have them pre-activated, their HERV-K particles already being produced. So when you fight an infection, it's the levels of HERV-K particles that are in the blood are at 10 to the 12th per mil. That's a lot the And for example, SARS-CoV-2, on average, the particle levels are about 10 to the 6th per swab or per mil, depending on how they do their assay. And at the most, it's 10 to the 9th. So here we have a system that reaches 10 to the 12th particles per mil. So that's a lot of protection. So what we would like to do, I think, is to activate the HERV-K 102 particles in frontline workers. So for example, there is a vaccine that is available. It's called the BCG vaccine, and it's noteworthy because this is actually an innate immunity vaccine, and we know that tuberculosis induces these so-called foamy macrophages that make these particles. So there are a number of trials worldwide that are looking at using the BCG vaccine in people who are frontline workers. Now, it's also being tested in people who have comorbidities, and unfortunately, I believe, in my opinion, that's a mistake, because people who have comorbidities already have immunosenescence. If you hit them with a vaccine, it's a vaccine or even virus particles like COVID-19, you're going to activate more immunosenescence and give the person more disease. And, for example, worst case scenario, they might suffer a heart attack. And I don't think that's what you want. So in the case of the people that are sick or have comorbidities, the best thing to do is to reverse the immunosenescence. And perhaps if they're in the hospital fighting COVID-19, they should be getting they're antagonists to AFP, and they should be getting the particles from donors, blood donors. So right now, people are using convalescent plasma from people who survived COVID-19, and these people will actually have antibodies, and they'll be screened for antibodies to the SARS virus, but they will also have the particles, hopefully, and the HERV-K102 particles for protection. So they're people who are sick cannot get the BCG vaccine, in my opinion. So in this case, you would simply use the convalescent plasma.
So when you look at this slide that you've got here, and you are specifically focused on how to increase the amount of K102, is it these specific things that make a difference? The zinc, the isoflavonoids?
Yes. So what I'm showing here is how to reverse immunosenescence. So the flavonoids is what we had always used in the clinic. Now, we never use DHEA because it's illegal to use it in Canada, believe it or not. But anyway, if you live anywhere else, you probably have free access to DHEA. So obviously, if the DHEA, if you don't have enough DHEA to inactivate the AFP, you're going to be prone to immunosenescence. So the zinc, the DHEA, and the isoflavonoids are, these are actually AFP antagonists, and they will reverse immunosenescence. And what's funny about this, or a person should note, is these things are actually marketed as antivirals. And it's interesting because they may not be an antiviral themselves, but they behave as if they were because they allow for the release of the HERV-K102 particles, which protect you.
And so in terms of the other thing that you had mentioned is the Fordyce spots. Now, this is something I had never heard of before, and this is connected. I mean, it's like, wow, what is this?
Well, I actually noticed for quite some time, I have chronic fatigue syndrome, and it's an issue with too much HERV-K102 particles, if you can believe that. So, of course, with chronic fatigue syndrome, the problem is insomnia and the fatigue. But at any rate, so I knew I had these so-called Fordyce spots, but I didn't know, how does this relate to the fact that, okay, there's the image there. So you can see they're kind of a beigey spots on the underside of the lip. They can actually be on the outer side of the lip too, but mine are always underneath. I don't know why. So I knew I had these, but I was trying to figure, and this is only yesterday, so this is breaking news. So yesterday I tried to figure out, well, where is it in the mouth where these HERV-K102 particles are made? Because we know for foamy viruses, they integrate and into the DNA in all the tissues in the body because they enter any kind of cell. But we knew that they're active in the oral in the mouth. But where are they? Where's the structures that are producing this? So yesterday, so this is brand new news. So yesterday I tried to look up, well, somebody must have noticed this before now. And it turns out that Dr. Fordyce from New York City, of all places, because of, it's ironic, because of the epicenter for the US is New York City. He noticed in 1896 that these spots were there on the underside of the lip. And in fact, they're commonly found on newborns. And of course, HERV-K102 is active in newborns because it's innate immunity and it's what keeps them safe, I guess. And so I looked it up, and believe me, it's hard to find information on this. But at any rate, what they are is they're like sebaceous glands that line all the mucosal sites in the body. So they'll be on the lips, they'll be on the genitals of males and females, and we don't know for sure, but the accumulating evidence suggests these little granules these granules are the sebaceous glands that are making the HERV-K102 particles. So I posted an article on it last night, and you can read about it on LinkedIn. If you just go to HERV-K102, you'll go to my profile page, and it's actually a featured article on my profile page, so it's easy to find. And you'll see these sacs are making these particles, and nobody knew what they were or what they were doing, and why do newborns have this, and why is it on all the mucosal parts of the body where this is where the viruses enter the body, so why are they there? So this is something really new, and it's so exciting for me because it means you can look at somebody's mouth and see whether they're protected against COVID-19 or not. I mean, you can't get anything faster or cheaper a test for whether you may or may not be protected against COVID-19. So let's hope the research gets done quickly to prove or disprove this theory, and to use it and see and get the epidemiologists out there marching the streets and counting up who's got it. And the interesting thing is it's the number of these granules, which probably will indicate how many particles are you making. So it's so exciting. I'm over the moon. It's just too exciting, too strange and important. But it's I think it's real.
Wow. Now listen, we've got that breaking news here. Isn't that tremendous? And so
yeah.
What takeaway in terms of keeping people healthy then would you say? What advice would you give to people now in the midst of this COVID pandemic?
Well, if you want to show that last slide, I summarize it very as my take-home messages. So the most important thing to protect yourself against COVID-19 is to make sure that if you have immunosenescence, to reverse it and to prevent it. So this is really important for people over the age of 50 and people with chronic diseases, people that have elevated high specific CRP, or who have high blood pressure. And to do this, it's very simple. You just take 30 milligrams a day of zinc citrate, 50 milligrams of DHEA if you're female, and 100 milligrams of DHEA a day if you're male, 40 to 60 milligrams of isoflavonoids. You need a good once-a-day vitamin mix. You probably need a little more vitamin C that's in your vitamin mix. And your vitamin D, if you're not getting a dark tan right now, you probably need at least 1,000, perhaps 2,000 international units a day as well. Now, lysine, this is especially for people who are not eating meat every day, or not drinking milk, or not eating cheese every day. It's very important for them to take 1,000 to 3,000 milligrams of lysine a day. Now, lysine is actually marketed in Canada as an antiviral and something that boosts your immune system. And the reason why lysine, the K in HERV-K102 stands for lysine. It uses lysine as a transfer RNA to initiate reverse transcription before it integrates into the DNA, and all retroviruses must integrate into DNA in order to replicate. So you need this amount of lysine per day to back up the production of the HERV-K102 particles. Lysine is one of the essential amino acids, meaning that you can't make it on your own and you have to eat it every day. So the other things you need to do to remember, and this is basically the same guidelines as Hypertension Canada, you need to exercise regularly. You need to have at least 3 hours a week of aerobic exercise. You need to maintain a healthy weight. You have to get good sleep, go to bed at the same time, dark room, etc. And you have to stay away from carbohydrates. Carbohydrates is so stressful on your body, particularly as you age, it's ridiculous. Don't smoke, that's immunosuppressive. Don't use alcohol, it's immunosuppressive. Don't use cannabis, it's immunosuppressive. And virtually all of your herbal medicines are immunosuppressive, especially turmeric, for example. A lot of people use that for this, that, and the other thing. That's the same issue as treating a chronic illness with an anti-inflammatory. It doesn't cure the disease, it just prolongs disease. So you need to get at the cause of immunosenescence, which is this AFP. That's why I'm saying the zinc, the DHEA, the isoflavonoids, etc. And the other thing that I want to really impress upon people worldwide is that it's been shown by Dr. Niti, who's the world expert on innate immunity and trained innate immunity. He has shown that statins block the induction of trained innate immunity, which is basically HERV-K102 particle production. So if you need the HERV-K102 to resist the COVID-19 disease, you have to stop taking the statins. And most people take statins even though they're healthy. And they shouldn't be, because actually last year it was proven beyond a shadow of a doubt that high cholesterol does not cause atherosclerosis or heart disease. It's viruses, actually. But anyway, there was a paper last year in Nature Medicine by Fernandez et al., which showed it's not the lipid-containing foamy macrophages, which everybody thought caused heart disease. It's the HERV-K102 when there's immunosenescence and they can't get released. So if the cells aren't lysing and they aren't releasing the particles, this means that you have accumulation of dysfunctional macrophages that are immunosuppressed, and they release all these awful pro-inflammatory factors. So you don't want that.
Wow. That is a most comprehensive explanation and detailing all of the reasons. That is truly quite remarkable. And I think that we need more persons like yourself doing this kind of research in order to try and clarify the way forward, because at this point we really don't have enough answers and enough ways to protect the populations across the world. I want to take this moment to say thank you very much, Marian, for joining us.